You wrote, sometimes growth doesn't come from climbing higher or pushing harder. Sometimes it comes from seeing differently. How you think about operational excellence and the balance of hitting goals, and I know people is a really important factor to the work that you do.
I don't think that in healthcare we sometimes recognize enough of how challenging things are for our people and how important that patient experience is, right? How do you create an experience for patients that they want to come and they want to experience what you have to offer? You can be like the best of, nationally ranked, and you can have the funnest tools and toys and imaging equipment and all the things. But if the patients don't walk in and immediately feel welcome, if it's not an easy way to access an appointment, if you're making unnecessary barriers to getting that care, then those patients are going to go elsewhere, right? But our patients' experiences or expectations are getting to that level, right? They're getting to the level of when I come, I'm paying thousands and thousands of dollars out of my pocket. My insurance is paying all this money. I've got this high copay, this co-insurance, and I expect really good treatment. Right? I expect not only expert doctors, but I expect that people are going to take really good care of me while I'm there. And so that's where, to me, like, you can't lose touch of that, like, experience. You can't lose touch of your vision, and you can't lose touch of like what the grounding factor is. So you really have to focus on, how do I get those patients in the door? How do I make sure that their experiences, that they want to come back and they want to tell their friends about us, right? And then how do I continue to grow that? My perspective on how we approach things from the patient's lens in order to create that somewhat organic growth, right?